So I guess my first question is probably going to be to Joe, really. So Joe, where did the concept for cutlery-free dining originate from?
Well, there are many reasons why a person might have difficulty manipulating cutlery at meal times or when they're eating a snack. Physical conditions such as Parkinson's disease and arthritis or a stroke, and cognitive illnesses such as dementia can cause a person to have difficulty processing their environment or even manipulating things like knives and forks and sequencing and coordinating that actual task of eating a meal. In the care home environment, although meal times do have the potential to be one of the most positive and social aspects of the day, for a resident who has difficulty with cutlery, it can be one of the most challenging times as well, and it can be really a really difficult time. And traditionally, I suppose, having worked in the sector for a lot of years, residents who struggled to use cutlery were frequently served finger foods. And far too often, that meant buffet food, quiche, pastry-based things. Now, not only are these types of dishes generally nutritionally far less appropriate, but they also risk stigmatising a person because we have residents sitting at a dining table eating different food to the person next to them. And it just provides a visual clue and reminder all the time that that person is disabled. And that's not okay. And our residents deserve better. Interestingly, back in 2012, a report by the Care Quality Commission identified that vulnerable residents are at risk of malnutrition if they don't receive the right level of support at meal times. And although we've made progress over the last 8 years or so, we still have a collective responsibility to continue to work to make sure that every resident living in a care home is able to enjoy nutritious and appetising meals and snacks all the time.